Hi, I'm David Levine. I'm co-chair of Science Writers in New York. The other co-chair, Joe Bonner, is behind the scenes. He's operating the cameras and he'll be recording this. I'm going to introduce Ryan.
The long haul, solving the puzzle, the pandemic's long haulers and how they're changing healthcare forever. There's a book. It came out November 15th through the Post Hill Press, and it's being distributed by Simon & Schuster.
Okay. So Ryan covered health, science, and wellness during the COVID-19 pandemic. He's a journalist based at CNN in Atlanta. He specialized in feature writing, guiding, going deep with characters who are on a mission and have a message for all of us. He's fascinated by figures, both large and small, who dedicate their lives to changing our world. He is profile Nobel laureate, I can't pronounce this, Kailash Satyarthi.
Kailash Satyarthi, yeah.
Okay, legendary journalist Ted Koppel, the New York Times bestselling author Stephanie Land, to name a few. He likes to write about politics, foreign affairs, health, and science. In 2019, Ryan wrote about a college dropout who was bedridden for 11 years, went on to invent a new surgery and cure himself. The story received the highest engagement of any story published by CNN in 2019, and the third highest for all online news outlets. So, welcome. So why don't you give I read your book. Not everyone's read your book. Why don't you give a little history of how you came to write about the book, and also about the illnesses that you suffered through.
Yeah, and thank you for having me. And it's great to speak with everybody tonight. I usually start by explaining my entry point for writing this book, with most people's entry point into the pandemic, about being wherever you were around mid-March of 2020. At least for Americans, that was when the virus was coming to our shores, and we were kind of entering into this lockdown phase. I was a features writer for CNN at the time. I was covering health and science, and began writing in-depth feature stories about people who had COVID and who were having the long-term effects. And it was important to me to write write these stories at this time during this pandemic, because backtracking earlier in my life and career, I myself had a post-viral disease and had become an advocate and a filmmaker for people who had similar diseases. It's called myalgic encephalomyelitis and chronic fatigue syndrome. And our community understood, this is the patient community of which I'm a part, which was separate from my day job at CNN, that we understood that there was going to be long-term effects from any virus. And so because there was a global pandemic, it was clear within the chronic illness community that there was a decently high percentage of people, up to 5 or 10% would be disabled, have a long-term illness because of COVID. And we didn't have the word long COVID yet, and we didn't have the word long hauler yet. But it's certainly a feature of the human immune system, and a feature of how we respond to viruses, that a certain set of diseases always occurs. And I wanted to set off to write more deeply about that, and what this historical moment holds for how we rethink how patients are involved in the healthcare system, and how the human biology works. That this could be a breakthrough moment for probably more than a dozen different diseases that have a known viral trigger.
So you draw a parallel between the activists during the AIDS era, who protested and got government funding, got the FDA to approve drugs more quickly, got compassionate use programs. Mm-hmm. And you start off telling the story of Amy Watson, mm-hmm. and 47-year-old preschool teacher in Portland, Oregon, who fell sick on March 15th, 2020. So why don't you tell about her and how she got involved?
Yeah, Amy Watson is the founder of a important Facebook group that started collecting people who were had long-term effects of the virus, and so she it puts on her lucky in the story. She puts on her lucky trucker hat, her lucky long hauler hat, and she goes to get tested. She's been sick for weeks at this point, and she's trying to figure out if it's COVID. And she's finally been able to get out of the house, and so she tests positive. So she creates this group called the Long Haulers Support Group in honor of her long hauler trucker hat. And so the word long hauler is what anybody who has got long-term effects of COVID is called a long hauler. And the word long hauler is part of entered into the Merriam-Webster's dictionary. So that became a word just in the same way that the word second gentleman, when you're referring to Kamala Harris's husband, also entered in the dictionary. So that's become common parlance, but it comes back to this preschool teacher in Oregon. So that's part of her story. And what's important here is that the patients are able to rally together online through social media in ways that HIV patients were not able to do. So although you've not seen these large scale ACT UP style marches for the most part for long COVID, a key feature here is online activism. And I think that's part of the argument in the book about the future of healthcare and how patients can assist research by gathering their own data that way.
And to give people a little understanding, you talk about some people report malaise, and you write the term malaise doesn't begin to express what patients feel. Some researchers prefer to call the phenomenon post-exertional neuroimmune exhaustion. So I guess my question is, it's coming to a kind of full body exhaustion that can follow even the most basic activities such as taking a shower or climbing a set of stairs. When I was in my 20s, I had a flu. And I remember I just took a shower and I just said, I'm going back to bed. And that lasted like 3 months. And I didn't get tested to see what I had, but I'm sure it seemed to be more than a flu, although bad flu. But okay, so is there a clinical definition of what long haulers in, and also is there a name that besides long hauler?
Yeah, and long COVID is the most widely used term, and in government research circles, you see more of this term post-acute sequelae of COVID, PASC, but most regular people are not going to go around saying they have PASC. They'll just say they have long COVID and they're a long hauler, and I think that's important to have a common parlance. But this term post-exertional malaise is the cardinal feature of ME/CFS, and it's the cardinal feature of long COVID. And that it can be like having the flu mixed with running a marathon, mixed with having a bad hangover. That's how some people would describe it. And small exertions, in this case, taking a shower could be one. Walking around the block, taking the trash out. So people who have a significant case of long COVID or ME/CFS experience a huge crash after doing kind of basic activities, or having it could be an emotional or mental exertion in addition to just being like a straight physical exertion, like taking out the trash. And this it's called post-exertional malaise, but really this post-exertional neuroimmune exhaustion is maybe a better term for it. Malaise kind of seems like, oh, it's like a lazy Sunday, whereas what's actually happening is that there's a failure of your body at the cellular level to create energy, and probably at your mitochondria, which is the powerhouse of the cell, are not functioning correctly. And when you interview patients, and I interviewed hundreds for this book, they all speak about the same phenomenon, and they all tell this similar story. So you almost always know exactly, you can kind of predict what they're going to say before they're going to say it, because post-exertional malaise is so common. And so that's one of the most important things for our researchers to be looking further into, to understand the underlying cause of long COVID.
What struck me also is that a lot of people were very healthy and actually athletes, like some marathon runners who can. There's one woman who can't even walk her dog anymore.
Mhm.
And
Yeah,
so
previously healthy people.
Yeah. So, and this also affects children and teenagers.
Mhm. Yeah, and that's a important point I want to make sure they get across in this book, and then in talks I give around this story that long COVID certainly happens in kids, and there's a long COVID kids is a major support group, and long COVID families. So there's a belief that COVID does not affect children, but that's a thing that we would want to push back on and explain, that so many families feel so devastated because their children have the illness. And having gotten ME/CFS myself as a teenager, some of those interviews were some of the most emotional for me. Knowing what it felt like to kind of tap into my own trauma from my own illness is part of that. And then listening to parents, really lament or cry over children who are terribly ill, and to be so distraught that like they know that their mission in life is to try to get their kids better. And I think sometimes talking or interviewing caregivers is actually a lot harder than interviewing the patients themselves, because when you see pain and suffering through the lens of a loved one, it's actually that much worse.
Now, the other thing that struck me is that there isn't much help out there. I mean, there's no insurance. Insurance companies aren't paying for long-term COVID.
That's changing, and there are billing codes that are being rolled out, but that was particularly a major problem early on. And just simply getting the word out that there is such a diagnosis as long COVID is part of this, getting it into the ICD-10 codes, the International Classification of Diseases, the World Health Organization uses to talk about the diagnostic codes, which therefore translates to billing codes. And doctors have a hard time putting patients into a category for diagnostic purposes, but also for reimbursement purposes. And so when patients don't have an easy diagnosis, one reason they feel gaslit is because doctors themselves are handcuffed by this bureaucratized system that they themselves are part of. So a doctor is reluctant to make this sort of diagnosis if they can't really do anything about it. So, all right, so someone gets COVID, they're usually typically sick about 2 weeks, and then they start to feel better. Mm-hmm. So what happened? What's the sequel of events for a long-term COVID patient? Yeah, so for long COVID, the most common thing would be getting sick and never really getting better, and it frequently comes from mild cases. It's clear that if you got more severe, so you get hospitalized or die, that there's a certain pathology of a pneumonia that sets in, and cytokine storms can result in the body being at war with itself. And so there's a whole set of crises that take place in a severe acute case. Now, in these more mild cases, which are somewhere in between asymptomatic on the most mild end, and then a hospitalized case that's more severe, the mild cases are where a lot of the long COVID comes from. And so that was not part of the original public health messaging around the disease, which was basically that I talk about this in the first sentence of the book, that it was communicated that you're either going to die or you're going to get better within 2 weeks. So there's a huge number of people who fall in between, and who's develop either symptoms or new diagnoses directly after the virus, which could be 3 or more weeks afterwards, and certainly people who've been sick for at this point 2.5 years, dating back to the original first wave, that people whose their lives are simply not the same.
And what are some of their symptoms?
Yeah, fatigue and brain fog are the two most commonly cited symptoms. From there, there's post-exertional malaise, I think, is the key marker of what a pretty broad swath, more than 3/4 of patients can experience post-exertional malaise, and that's where about half of the patients align with this ME/CFS diagnosis, which is a disease that can be described as severe as late-stage AIDS or renal failure. So that's where that severe fatigue, the inability to recover from minor exertions, the inability to create energy. So fatigue doesn't really even begin to describe it. Brain fog can manifest, and a lot of brain fog I don't think is really sufficient either. It's a full spectrum cognitive dysfunction. That's memory loss of ability to read and write in certain cases. Your overall decision-making faculties are significantly worse. So you've got, in one case, interviewing somebody who's a cardiologist who can no longer, because it's common that, insert, career field here, that if they're a novelist who can't write, in some cases a sommelier who can't smell or taste, the cardiologist who can no longer practice medicine, that when you lose your mental faculty and you lose your ability to create energy, that's where significant disability happens. And so we discuss this now as a mass disabling event. We know that COVID was a mass casualty event, but for people who don't die from COVID and who get long-term illnesses, they could have years, or if not decades, of disability to deal with. And so that's a big genesis or impetus for writing this book, was to tell those stories and to rally the case for more research funding, and also for more disability services. I think that in the short term, that's the best way to help.
So someone asked, I would like to ask Ryan about the state of research on long COVID, whether more funding will be available for that in the future.
Right. One of the biggest sources of funding right now is a $1.15 billion Recover initiative that's being run through NIH, and that's mostly the observational study, which is good. It's getting classifying parts of long COVID, but I think that there's still a huge need to do better molecular diagnoses to get to the underlying mechanism, which I don't think Recover is overly likely to find. So there's another, and then a issue with the Recover initiative is that there are not widely available clinical trials that patients can become part of, and then therefore we're not currently on that glide path for which there's going to be an approved drug for long COVID soon. So that's where I think that I've been calling for sort of like a Operation Warp Speed to fast track or repurpose drugs, and to do this in a patient-centered way. And I think that so there's a number of critiques I would make about how the research is being done and how it's being funded. Department of Health and Human Services is asking for another $750 million from Congress in the next budget cycle. And I think that would also create more impetus for clinical trials and for more molecular research. One of the biggest ongoing things now is there's a $15 million long COVID research initiative, which is largely run through private donors. And then the most promising research is being done through the Patient-Led Research Collaborative. And it's a huge part of this book is about patient-centered healthcare and patient-led research. And Patient-Led Research Collaborative has received about a $5 million grant from the co-founder or founder of Ethereum. And that may be some of the best research that is coming out, which is being allocated by the patients themselves.
Who's the co-founder of Ethereum?
Vitalik Buterin is the
Oh,
which is Ethereum, but then it's a philanthropic group.
I met them, him and Elise. Yeah. So someone wrote here, can you look at the chat for a second? The webinar chat says,
Yeah.
Because it's a very long question, and I'm not sure it's something you want to really get involved with. In the 1988 BBC Horizon program, Believe Me, researchers found enterovirus as a probable cause for an outbreak of ME in Scotland.
Myalgic encephalomyelitis. Yeah.
And right, and then she talks about they developed the VP1 protein test for all enteroviruses. So basically, is this test being given to people?
Yeah, and I don't know the answer to that specifically, but what I can say is that enterovirus is could be a major source of ME triggers. So we know that SARS-CoV-2, Epstein-Barr virus, a lot of these cases can come from, or similar type of cases comes from a Lyme disease infection. So enterovirus is in the same category that could be one of the insinuating incidents. And Dr. John Chia, who's in Los Angeles, California, runs the Enterovirus Foundation, and he spent a lot of time looking more directly into this. And yeah, it's hard to do this research well, but certainly enteroviruses can be isolated, and some subset of these patients with ME, and I don't know if that test is being widely done on all patients, but overall, in order to diagnose this ME, you'd want to do a full spectrum analysis of in rheumatology, infectious disease, neurology, endocrinology. So if you're doing a full workup for every possible infection that somebody could have had, then enterovirus is definitely one that you want to look at. But just a key problem here is that frequently viruses can be persisting in tissues in the body, and so they might not be detectable in the blood, and that is the case with some enteroviruses. If they're in the gut, they might not be showing up on tests, and so that there's all kinds of ins and outs of how to do the right test for the right virus. And some of those tests are looking for immune markers rather than for the virus themselves. And so that becomes it's a real bug hunt, or a real detective case for internal medicine to sort these things out. But yeah, for sure, enteroviruses are implicated in some way in some number of ME cases.
So there's Tim Kaine says he has long-term COVID, right?
Yeah, Senator Tim Kaine is probably one of the most vocal long haulers, and he's done a significant, really a tremendous job bringing this up in a number of different hearings when Dr. Fauci and others are testifying on Capitol Hill. Tim Kaine has been one of lawmakers who's convened town hall meetings with long haul patients, particularly in Virginia, which is the state that Senator Kaine represents. And so I think he's done a great job of leading with empathy and leading with his own lived experience. And so that is an important part of the book, and the argument I'm making is that patients themselves could be the leaders in forming a new and more responsive healthcare system. And I think case in point here is the former vice presidential nominee is one of the most powerful politicians in the country, is embodying this. And I think that yeah, more senators ought to be on board. And I think Tim Kaine is focused on trying to get this large allocation that HHS is asking for in the next budget cycle. He's been probably the foremost champion on Capitol Hill.
As we know, whenever a celebrity gets sick, they become great advocates for their illnesses.
And what's a key note for Senator Kane is he is not like severely disabled by the illness. He talks about it being a nerve, kind of a permanent nerve tingling sensation of feeling like he's had like 5 cups of coffee. So he's feeling it all the time, but it's not to the point where he's unable to keep doing his job. So you do want well-known or powerful people to understand what it feels like, but you also don't want them to be so disabled that they're out of commission and they were not able to actually affect change.
So as you know, with a lot of these illnesses, like like in the 70s, people in Marin County were getting paid from the government because they were disabled because they couldn't leave the house. And there was a lot of questions about, is there a psychosomatic component to some of these illnesses? Even like, or you get the thing that everyone thinks, well, we got to test for Lyme, keep testing for Lyme because that's underlying everything. And I think that we've kind of learned is that there's no one thing underlying everything. And also that there might be a psychosomatic component, but these people are really sick. They're not, I don't think anybody really wants to be bedridden, not be able to work, not be able to go out or do anything. And yet there's this. So, I mean, I think social media helps people not to feel so isolated. But there is also this isolating phenomenon. You can't do the things you used to do.
Mm-hmm. Yeah, and I think it's most important to explain that there's a real sense of a loss of selfhood that comes from this, and there's for sure a secondary depression or anxiety that comes from like if you're unable to be yourself, if you're disabled, if you can't do routine tasks like going to the grocery store and caring for your kids or going to work, that in itself is a huge blow, emotionally to deal with. And so I think doing proper psychological care for patients is dicey because there can be, if they're coming up normal on, and I'll emphasize like standard blood tests without getting access to more specialized panels that show a huge number of abnormalities. If they've not yet gotten access to an established post-viral expert, then they are vulnerable to a misdiagnosis that puts them into a psychological category that clearly the virus, SARS-CoV-2 in this case, has sparked this illness, and so that therefore is an underlying pathology. If science has not yet located the exact nature of it, it is a biological disease, not a psychological.
No, I understand, but they're also vulnerable to like cancer patients who go to Mexico and they see doctors who are disbarred and they give them vitamin shots and they feel better because they're not taking on their chemotherapy drugs, but they only feel better for a short time. So are there,
hucksters and charlatans can, get themselves into this space and prey on desperate patients. Yeah, that's absolutely happening.
So let's get to some questions. How are healthcare workers handling this for their own protection? One of my surgeons got COVID and our follow-up was delayed twice. Well, who knows? Okay, but
just a lot of the standard precautions about wearing a mask, distancing, quarantining, and isolating are important. And Dr. Francis Collins, who's the former head of the National Institutes of Health, and he testified in front of Congress, and I thought this was the most direct quote possible. The best way to prevent long COVID is to prevent COVID, and and obviously we're not doing a great job of doing that.
So someone asked me, if a person has long COVID, are they still contagious? At what point do they stop being contagious to others?
Yeah, so usually they're if they're not showing up positive on a PCR, through a nasal swab, then they wouldn't be contagious. So in the same way that someone is cleared to go back to work when when they're no longer shedding viruses, and usually that's within that 10-day period or so when they're no longer considered contagious. So the presence of long COVID symptoms does not imply that the person is going to be, if they breathe on somebody, that they'll give them COVID or long COVID.
Is there a tipping point that would prompt the agencies to say we have to get on this, like you mentioned, warp speed? So could there be a tipping point? I mean, I guess there could if everybody was getting it. So.
I think that explaining the economic fallout of this disease is probably the best way to communicate in dollars and cents to lawmakers and to appropriators who can communicate the budget part of it. The human story, that empathically telling what it feels like to have the illness, and getting those stories to healthcare aides on Capitol Hill and to lawmakers on Capitol Hill, that can have real impact. And important study from Harvard economist David Cutler says that projects that long COVID could have up to a 3.7 trillion, trillion with a T, impact on the U.S. economy, coming from medical costs and lost wages and inability to work, and the amount of disability that patients feel. And explaining this as like a macroeconomic issue, which 3.7 trillion long term, which is really hundreds of billions of dollars on an annualized basis, and the amount of research expenditure is a fraction of that in order to potentially find the cause and ultimate cure of it. So I think the economic case for significant research and expenditures is the clearest way to make that. And those studies are coming out again and again and again from Brookings Institute and the Harvard study that I mentioned earlier, showing a lot of this, different economists making the same sets of arguments.
Has the Social Security Administration been paying disability benefits to people who are unable to work due to long COVID?
A lot of patients experience that they apply for Social Security Administration benefits and get denied. It's very common, not just for ME/CFS or for long COVID, but for a lot of disabilities that to get denied on your first go around. And sometimes that process takes 2 or 3 tries, and over the course of multiple years. And then someone is fully disabled as they're applying for benefits, they're vulnerable to going even further into poverty and potentially homelessness. And so I think that there's a set of, I talk about this in the book, but there's a few different major ways that just streamlining the Social Security Administration's practices for approving disability in general is really important, and then getting the science to a place where long COVID can be diagnosed quickly and easily and universally at any doctor's office. If patients can show the proof that they have the illness, they're likely to get more or approved more quickly. Yeah.
Okay, so
but it is incredibly difficult to get disability for long COVID right now. Some people do get it.
Okay, so as you say, as Francis Collins says, the best way, not to get long-term COVID is not to get COVID. So I got COVID and I went on Paxlovid and felt a lot better. And I guess that's also its strategy is to knock out the virus. You can't. Yeah.
Yeah. If long COVID is caused by persistent viral infection, which is one of the prevailing hypotheses that is being tested, if it's caused by the virus lodging itself somewhere in your body in some tissue, it therefore follows that an antiviral drug that is directly targeted at this particular virus can wipe it out. And so Paxlovid is something that works well in acute cases and deserves a very hard look for long COVID cases, because that could easily address some subset of the full long COVID patient population.
So let's say, you know, I have a child and they have long-term COVID. Who do I go to? I mean, is there are there centers, you know, I know that Johns Hopkins has, you know, the center for people who they can't be diagnosed very clearly. I mean, what should a parent of a child whose COVID is not going away do?
Can you hear me okay?
Yes.
Okay, so okay. Can you say the question again? You got a little jumpy there.
Sorry, yeah, I lost you for a second. So if a parent has a child who is not getting better, who's feeling tired all the time, where should they first turn to?
You know, the first thing that we want to make sure that's that just because they're having symptoms consistent with long COVID doesn't necessarily mean they have long COVID. And I worry about that, you know, as a journalist and advocate, you know, covering this disease. I don't want long COVID to be the catch-all. And if people hear, you know, think they have long COVID and then they engage in a set of therapies or just profound rest is the thing that I advocate for. If they have a different disease that is not long COVID, that needs to be found quickly. So you still want to go through a workup where you're visiting various specialists, infectious disease, rheumatology, endocrinology, etc. And I'll just, one cautionary tale is one of the people who I end up not featuring in the book, because I thought he was one of the most interesting cases of long COVID. He ended up having lymphoma, and so that was why his scores were so all over the map when he was steaming a lot of his blood tests, and one of the people I was going to interview for this. And so just because they start having crazy symptoms that are tied to the SARS-CoV-2 infection, it might just be that unmasked some other disease that was going to get unmasked anyway. So that, number one thing is make sure you do roll out other diseases that could be causing the same set of symptoms, and because fatigue is universal, like practically every condition causes fatigue. And then if you strike out in trying to get a diagnosis from the usual set of suspects in terms of medical specialists, that's where there's certainly long COVID clinics are an important thing to get referred out to if those are available in your city. Not every long COVID clinic is effective, I guess I'll say that. And so finding the right long COVID clinic is part of that. And then being able to navigate to, if it ends up being consistent with ME/CFS, you'd want to have, there's probably only a handful of specialists in the country that cater to these types of patients, but getting an expert who can look through this more holistically with you is what we advocate for. But number one thing is rest. If you're feeling, if you're crashing after small exertions, you have to make sure that you stay within your energy envelope. Don't overdo it. Profound rest is the key to hopeful recovery.
So can you tell your story about, because you found a cure for your illness that was a little bit unusual?
Yeah. So I was sick in high school. I was unable to go to school for about 7 months during my junior year of high school, and did the same process of going through a whole bunch of different specialists before getting to this answer of calling it chronic fatigue syndrome, or myalgic encephalomyelitis. And so I found a doctor in Atlanta who caters to people with CFS, fibromyalgia, and Lyme disease. And that is not covered by insurance. Partly because it's so complicated, and it was a a years long process to sort through a lot of the underlying infections that she was finding, and immune imbalances or endocrine imbalances, in sorting through all the different sleep issues I was having. And so it's not a simple process, but she's a conventionally trained family practice doctor who just had additional specialty training in this particular area of medicine. And but yeah, I was taking a good number of supplements throughout in college and throughout my 20s, and it was getting an infusion once a month that helps kind of address a lot of the underlying deficiencies, I guess, from a nutritional standpoint. It works for me, and I don't want to evangelize too much about this type of treatment, because it may or may not work for others, and some people are too sick, they're either too sick or been sick for too long, or they're just the underlying way in which ME/CFS or just sort of a complex chronic illness has manifested. It might not be applicable in their case. So I'm fortunate that I am in a category where I would say about 90% recovered. I do have spells of being sick for a few weeks about every year.
Is the average person with long COVID expected to recover?
The jury is out on that, and there's a whole bunch of different variables here that partly the variant, if it's a Delta or Omicron, that's one thing that people are clinicians and researchers are looking into. Whether or not the person's had the vaccine or a booster is a complicated part of this. So getting the prevalence numbers out has been kind of raising an alarm about the illness in the first place is important. Now but just to answer your question more simply and directly, that as the number of months increases that someone's been sick, you'll see a decrease in the likelihood of patients getting better. So long-term illness is very important to highlight. And I don't want to be alarmist and for people who have been sick for 6, 8, 12 months, because recovery is possible. But from a public health standpoint and from a research standpoint, I want to highlight that recovery rates do drop off when people have been sick for longer.
So we have social media, unlike past plagues and the HIV 1980s. Which sites should people look to for support?
Yeah, in the book, I spent a lot of time talking with leaders of the Body Politics Support Group, which is
right. Yeah, very interesting.
On Slack. There's also the Survivor Corps, which is on Facebook. There's Long COVID SOS, Long COVID Support Group, and then we talked about earlier with Amy Watson's Long Haulers group on Facebook. These are a bunch of the different prominent social media groups that people can join to I think finding others with the same condition and getting a sense of validation is life-changing, just to meet others who share your same experience. And then that can be the most helpful way to discuss potential treatment options for yourself or for your family, and then to get directed to in a very, very specific way to what exactly you need in your particular case. And that could be through disability services or through family support or through a specific line of research. But peer support is, I think, a key way that the healthcare system in general can improve that. So if a patient is leaving a doctor's office and they get a diagnosis, a prescription, and then an invitation to join a peer support group, I think that a lot of things can improve quickly for patients if they just have the chance to talk to other patients.
Yeah, I think so too. I think it's very helpful. I've seen that in breast cancer groups, which I profiled, and yeah, it's great to have to see that you're not alone so much. So give us give us some statistics. What percentage of people who have COVID go on to develop long COVID?
Yeah, the studies varied in different ways, but the standard definitions usually between 10 and 30% of patients could be getting long COVID, and then the CDC has a study that I think is one of the easiest ones to cite that says that about 1 in 5 patients who are infected with SARS-CoV-2 goes on to experience one or more new symptoms within a month. One or more new symptoms, or one or more new diagnoses in the month after testing positive for the virus. So I think that there's a lot of ways that even if it's not presenting in the direct fatigue, brain fog, post-exertional malaise way, people have pain, nerve tingling. They may headaches. Frequently, menstrual issues are reported. A lot of this comes down to abnormal blood flow, and so looking into microclots is one of the very specific ways that I think that we may find the underlying mechanisms. But 1 in 5, I think, is the number that I feel comfortable citing, and then that's a broad definition of just saying that having new symptoms in the weeks or months after the infection.
So does COVID affect the organs? I know that people have talked about COVID's effects on the heart and the lungs and clots and things like that. Is there a typical sequelae in long COVID, or there's not really?
There can be overt organ damage. So like first thing you want to look for is demonstrable heart damage, lung damage, or kidney damage, etc. What was most common in a lot of long COVID clinics that were being filled up by people who had long-term symptoms, and originally they were geared to look into more widely understood organ damage, and so a lot of these long COVID clinics were perplexed early on that so many people without clear organ damage were being sick for so long, and a lot of that's driven by it's dysautonomia, so a dysregulation of the autonomic nervous system, so the part of your body that controls automatic functioning isn't working, and then so the abnormal blood flows is a key part of this. The dysautonomia is a key part of this, and those are areas where either there's not enough research or not enough education, that many doctors come out of medical school not even having heard much about dysautonomia. But among patient groups and among I think the most cutting edge experts, dysautonomia is the kind of the first phrase I think that anybody should understand as like an overarching concept that helps unify a lot of these symptoms where organ damage might not be obviously present.
I want to tell you that on December 6th, next Thursday, we're going to be discussing lithium which is used for bipolar disorder, but to use it for regular depression. And we have a psychiatrist who says that it's more effective than drugs like Zoloft and Prozac. So that's something we're going to do. And also in beginning of January 3rd, we're going to have Sue Shapiro going to talk about how to get published. And she's whenever she's on, we get a lot of people turning in. Anyways, I think I'm going to end this here. And I want to thank everyone for listening. It's a really good book. And I'm sorry we had the technical issues. The book is The Long Haul, Solving the Puzzle of the Pandemics, The Long Haulers, and How They're Changing Healthcare Forever. It's published by Simon & Schuster. and you can get it on Amazon. You can get it in your local bookstores. And anyway, Ryan did a great job with his book. It's very readable, and his story is very interesting. So anyway, I want to thank everyone for tuning in, and I'm sorry about the technical difficulties.